Welcome to Season 2 of TelehealthFX Talk. We're back, and we're starting this season with what might be the most important clinical data in the entire GLP-1 story. Today, we're talking about the SELECT trial and what it proved about semaglutide and your heart. Because here's the thing that changes everything about how you think about GLP-1 medications. Semaglutide doesn't just help you lose weight. It reduces heart attacks, strokes, and cardiovascular death by 20%. That's not a marketing claim. That's a randomized controlled trial with over 17,000 patients published in the New England Journal of Medicine. If you or someone you love has heart disease risk and is carrying excess weight, this episode could change the conversation. Visit TelehealthFX.com, that's TelehealthFX.com, to see if you qualify for the only obesity medication with proven cardiovascular protection.
Let me set the stage for why this trial matters so much. Heart disease is the #1 cause of death in the United States. Obesity is one of the primary drivers of cardiovascular risk. For decades, we've had medications that help people lose weight, but none of them had ever been proven in a large clinical trial to actually prevent heart attacks and strokes. Weight loss was assumed to help the heart, but it was never proven with a dedicated cardiovascular outcomes trial for an obesity medication. The SELECT trial changed that permanently.
So let's walk through the trial. SELECT stands for Semaglutide Effects on Cardiovascular Outcomes in People with Overweight or Obesity. It enrolled 17,604 adults who were overweight or obese with a BMI of 27 or higher and who already had established cardiovascular disease. Importantly, these patients did not have diabetes. This is critical because it isolates the cardiovascular benefit from the blood sugar benefits we already knew about. Half received semaglutide 2.4 milligrams weekly, the same dose used for weight loss. Half received a placebo, and they were followed for an average of 3.3 years.
The primary endpoint was MACE, which stands for Major Adverse Cardiovascular Events. That's a composite of 3 things: cardiovascular death, non-fatal heart attack, and non-fatal stroke. This is the gold standard measurement that the FDA and cardiology community use to evaluate whether a drug protects the heart, and the result was definitive. Semaglutide reduced MACE by 20% compared to placebo. The hazard ratio was 0.80, and it was highly statistically significant. That means for every 100 heart attacks, strokes, and cardiovascular deaths that would have occurred, semaglutide prevented 20 of them.
And here's the part that really changed the scientific conversation. The cardiovascular benefits appeared to be independent of the amount of weight lost, meaning patients who lost a lot of weight and patients who lost a moderate amount of weight both showed heart protection. This suggests that semaglutide is not just protecting the heart because you weigh less. It appears to be directly protecting cardiovascular tissue through independent mechanisms.
And that's backed up by what we know about how GLP-1 receptors work in the body. GLP-1 receptors don't just exist in your gut and your brain. They exist in cardiac cells, in blood vessel walls, in immune cells. Semaglutide appears to protect the heart through at least 8 different mechanisms. It reduces systemic inflammation, which is one of the primary drivers of atherosclerosis, the plaque buildup that causes heart attacks. It directly slows atherosclerosis progression. It modestly but consistently lowers blood pressure. It improves cholesterol markers. It dramatically reduces visceral fat, which is the type of fat most strongly linked to cardiovascular disease. It improves endothelial function, meaning the lining of your blood vessels works better. It favorably remodels cardiac structure, reducing strain on the heart. And it may have direct protective effects on heart tissue through GLP-1 receptors in cardiac cells.
Based on the SELECT trial results, the FDA gave semaglutide, marketed as Wegovy, an expanded indication specifically for reducing cardiovascular risk in adults with cardiovascular disease and overweight or obesity. This made semaglutide the first obesity medication in history to receive a cardiovascular indication. It puts semaglutide in the same pharmacological category as statins and blood pressure medications when it comes to heart protection. That's an extraordinary statement for a medication that most people still think of as a weight loss drug.
And it doesn't stop there. The STEP-HFpEF trials looked at semaglutide specifically in patients with obesity-related heart failure with preserved ejection fraction, which is one of the most common and hardest to treat forms of heart failure. These trials showed that semaglutide significantly improved heart failure symptoms, exercise capacity measured by the 6-minute walk test, quality of life, reduced inflammatory markers, and even attenuated adverse cardiac remodeling. The benefits were consistent across all ages, including patients 75 and older. And again, the improvements appeared to go beyond what weight loss alone would explain.
So what does this mean for you? It means that if you have obesity and any cardiovascular risk, whether that's a family history of heart disease, high blood pressure, high cholesterol, or established cardiovascular disease, semaglutide isn't just helping you look better, it's potentially adding years to your life. This reframes the entire GLP-1 conversation. This is not a vanity drug. This is a cardiovascular intervention backed by one of the most rigorous clinical trials ever conducted in obesity medicine.
And for the guys listening, remember from episode 13 that obesity-related heart disease deaths in men increased 243% between 1999 and 2020. For seniors from episode 18, cardiovascular disease is the leading cause of death. The SELECT data makes the case for semaglutide in these populations overwhelming.
And this is exactly why TelehealthFX offers semaglutide as a cornerstone of their platform. They're not selling you a weight loss shortcut. They're providing access to the only obesity medication that has been proven in a randomized controlled trial to reduce cardiovascular death, heart attacks, and strokes. Their licensed clinicians evaluate your cardiovascular risk profile as part of the clinical assessment. They offer semaglutide alongside tirzepatide, ceramorelin, NAD+ therapy, and berberine, all with 24-hour provider review, one-on-one onboarding, transparent pricing, no hidden membership fees, 2-day UPS shipping, licensed in all 50 states. Visit TelehealthFX.com. That's TelehealthFX.com.
The SELECT trial is one of those moments in medicine where the evidence is so clear that it changes clinical practice. If you have obesity and cardiovascular risk, the question is no longer whether you should consider GLP-1 medication. The question is why you haven't started yet.
If you're ready to take the step that protects your heart while transforming your health, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz. Talk to a provider about your cardiovascular risk. This is not about weight loss. It's about longevity. That's TelehealthFX.com.
And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. Cardiovascular disease management should involve your cardiologist and primary care provider. Not all GLP-1 medications have the same cardiovascular data. Tirzepatide's cardiovascular outcomes trial is still ongoing. Individual results vary.
Thanks for joining us for the Season 2 premiere. Share this episode with anyone who has a heart to protect. We'll see you next time on TelehealthFX Talk.